Welcome to the Functional Medicine Doc Talk podcast. I'm your host, Dr. Kurt Woeller, talking with experts in functional and integrative health and medicine, discussing critical information for improving your health and wellness to help you live a long, full life. Let's get to it. Hi, everybody. This is Dr. Kurt Woeller. Welcome to the program. And in this episode, I am joined by a Tracy Tranchitella. Dr. Tranchitella, or sometimes called Dr. T, is a naturopathic physician who works with a wide variety of individuals, including people who have digestive issues, autoimmune conditions, hormonal imbalances. And so we're going to have a conversation about naturopathic medicine, about Dr. Tranchitella's experience in this world, and how naturopathic medicine can be applied and used for people suffering with a wide variety of chronic ailments. We're going to talk also about how it compares to conventional medicine. Very interesting conversation coming up. So, Dr. T, how are you?
I'm doing well. How are you?
I am good. So I'm going to call you Tracy throughout this interview. So before we get started with the main topic, tell us a little bit about yourself, how you got interested in naturopathic medicine, and kind of just real quickly, your areas of specialty.
Okay. So I graduated from Southwest College of Naturopathic Medicine back in 1998. It is now called Sonoran University of Health Sciences. So they have different tracks other than a naturopathic program now. So it's under a different name. And that's in Tempe, Arizona. And I have been practicing for over 26 years now. And I came to naturopathic medicine in my search and interest of good nutrition. From the time I was really young, I was really interested in nutrition. I read a lot of books on nutrition and how food could help you to feel well, and noticing differences in how I felt when I ate healthier food. So I was reading a lot of books on nutrition, and my intent when I went to college, was to get a degree in nutritional sciences. But back then, they were telling me, well, you can get a job in a hospital or work for the airlines. And I was like, that just doesn't sound great at all, because notoriously they have bad food. And it didn't encompass everything that I was interested in. I was more interested in food as medicine. And I couldn't seem to find the program that I was looking for in a regular college setting. And so I ended up becoming an elementary school teacher, K-8 certified. And it wasn't until my husband and I moved to Maine, because he was going to medical school there, that I went to a lecture given by a naturopathic doctor. And she had some brochures in the back of the room. And I grabbed one of the brochures and I looked through it. I looked at the course curriculum and I was like, this is what I've been looking for. This is everything that I would want to learn about. It was just so much broader than just nutrition and balancing macronutrients. And there was just so much more to it. And it was such a whole body approach that I was really interested in it. And then I eventually learned that there was a new naturopathic medical school opening in Arizona. And at the time, my husband was looking at doing an internship there. And so I ended up enrolling and got in. And at that time, they offered a 3 and a 4 year track. And I did the 3-year track, which was pretty intense. I don't think they offer that anymore, because you're basically cramming 4 years of school into 3 years. But I finally found the thing that I was looking for, even though it was probably 10 years later from when I originally started down my path of thinking I was going to get a degree in nutritional sciences. So that's kind of how I started on my path of discovering naturopathic medicine. I knew it was sort of part of who I was, but I didn't know it existed as a profession. And when I finally found it, I was like, okay, this is a perfect fit.
So I know you've had your own some struggles from a health standpoint, which we're going to get into. Before we do that, what is naturopathic medicine? Can you define it, from its classical standpoint, and maybe where things have transitioned today?
Okay. So when I first started going to school and somebody would ask me, well, what are you studying? And I say, I'm going to school to be a naturopathic doctor. They would kind of furrow their brow and have this perplexed look on their face like, well, what is that actually? So I would describe it as sort of a third parallel tract of medicine. You have medical doctors, doctors of osteopathy, and then you have naturopathic doctors as well. And naturopaths, typically, they go through a 4-year undergraduate or a 4-year postgraduate program, and they do clinical training. We get all the basic medical sciences, but our modes of treatment are going to be different. We're going to use nutritional therapy. We're going to use homeopathy, nutritional supplements, specialized diets, naturopathic manipulative therapy, which is basically like chiropractic care. Some naturopaths use acupuncture. Some use IV therapy. Some use homeopathy. So there's a lot of modalities that we can tap into.
So you get all of that in medical training. Do you have to do additional training for some of that? Or is that just, do you sort of rotate through some of those different classes or courses just to kind of get a general overview?
We rotate through those classes. It's part of our training. And when you're in your clinical training, where you're in the clinic and actually working with patients, it's really up to you what modalities you want to use and become proficient in. And it depends on state licensure. I mean, currently there are 23 states that have licensure for naturopaths, and their licensure may be a little bit different. Some naturopaths get additional training in acupuncture because they have to, because of their state licensing, that you have to have an additional certification to be able to do acupuncture with your naturopathic degree and licensure. So it really depends on the state, but we do get training in all of those things. And a lot of practitioners will choose either specific areas of medicine to focus on and employ a lot of modalities to treat a narrow scope of patients. But then there are practitioners who will choose a modality of treatment and specialize in that area and treat all kinds of disorders. So, I guess it depends on what you really want to do as a practitioner, if you want to be sort of disease specific or modality specific.
So I know in the world of osteopathic medicine, the roots of osteopathy go way, way back to the 1800s. And it was originally, an approach where looking at structure and function of the body, trying to work on underlying health by, improving overall, the musculoskeletal system, which then translates into the immune system, digestive system, et cetera. And so it really sort of avoided a lot of the more allopathic approach, which was, the medications and things like that. And I'm assuming that the roots of naturopathy, which would now be called naturopathic medicine, for example, you can kind of go back and forth on those terms, was really rooted in those holistic approaches. And talk a little bit about that because, like a lot of these professions, things have sort of transformed over time as a lot of these movements, including osteopathic medicine, has tried to become more allopathic or, as we sometimes talk about, trying to get a seat at the table. So what was your experience in some of those foundational principles of naturopathy? And I'm going to get into your story as well, because it's going to relate to whether it's autoimmune issues or digestive problems and these other types of things that many people are struggling with. But just real briefly, what are some of those core basic principles, beyond what you described? From a naturopathic standpoint.
Right. So naturopathic medicine has like 6 core principles, and I wrote them down so that I could make sure I cover them, in as thorough as possible. So the first principle, and this is throughout all of medicine and anyone in the health profession, you take an oath to first do no harm. And basically what that means is you're choosing diagnostics and treatment methods that are going to be gentle to the patient. They're going to be less invasive and give you what you need without causing harm. Which makes sense, of course. The second principle is looking at the healing power of nature and acknowledging that people have their own course of healing and that nature can take its course if you remove those obstacles to cure. So, which is huge for me because so much of naturopathic medicine and even functional medicine today is really looking for the root cause of disease. That's kind of a catchphrase out there. We're always looking for the root cause. And I think in terms of naturopathic medicine, removing obstacles to cure, you're trying to remove the things that are blocking the body's natural healing process. And so that makes a lot of sense to me.
Give an example of that. What would be a real life example of removing the blockage or interference?
The obstacle to cure.
The obstacle to cure.
Well, I would say, I think a lot about gut issues because naturopaths focus so much on the gut because that is sort of like your interface to the outside world, really, even though it's on the inside of your body. So let's say you have a gut infection and you have all of these symptoms. You have loose stools, you have cramping, you have nausea, you have all of these symptoms. Well, we could give you, anti-nausea medication and Imodium or something like that and suppress the symptoms. But what your body is trying to do is purge and get rid of an infection. So as a naturopath, we can use some diagnostic testing. You can look and you can test the stool. Does somebody have a chronic lingering infection that is causing their problem? That would be the obstacle to cure. So you can choose to go in however you want to treat it. Naturopaths use medications as well, if they're appropriate, and get rid of that obstacle to cure, get rid of that infection, and then support the body's healing processes.
Excellent.
Okay.
Continue on.
Okay. And so the third principle of naturopathic medicine is to identify and treat the cause, which is kind of hinges on to the second one, basically. Rather than suppressing symptoms, we're trying to treat the cause of the problem. The fourth principle is doctor as teacher. And I think this is very inherent in the profession and really important because once you have worked with your patient, you're also there trying to help figure out what their issues are, but you're also trying to teach them how to take good care of themselves because moving forward, you want them to not need you so much. You want them to understand how to conduct a healthy lifestyle so that they can take care of themselves, so that they can be empowered to move forward. And then they come to see you when they maybe have other issues that they need to resolve or they want to advance their knowledge. But we really function as teachers to our patients. And most naturopaths during an initial visit are going to spend at least an hour with a patient and can really get a good history. So it's establishing that relationship and understanding where they're coming from, what their health issues are, and what might be contributing to their problems.
By the way, I look at that type of thing as removing the obstacle to cure, working with, talking with, teaching patients about lifestyle and exercise and diet and sleep, all of these things, because it's also empowering them. So once people become empowered in their own health care, they can make more informed choices and maybe not get themselves into a problem or an area where they may be taking something that they shouldn't be taking or being convinced to do something perhaps that is not in their best interest.
So, I would agree with you. Maybe that obstacle to cure is a lack of knowledge, and they just need to sort of refine their habits and be better at taking good care of themselves. So the fifth principle is treating the whole person, considering that we're not just treating a disorder. We're treating a human being who has a physical body, but they also have a mind and a spiritual life. And so you want to look at all of the factors that may influence their health in all of those realms. So you want to look at physical issues, mental health issues, emotional issues that might be contributing to their problems, environmental factors, genetic factors, and other things that we all experience. We're complex beings. We live in a world. We have relationships. We're exposed to things. We have an emotional life. We have past trauma. There's a lot of things that can contribute to those obstacles that might not allow somebody to heal well. And as the last one is prevention. We're strongly invested in helping our patients prevent future disease, assessing their risk factors and family history and their own personal history and things that we need to do to help support their health throughout the rest of their life.
Excellent. Okay. So your story, because this is important from the standpoint of what you do professionally and from the standpoint of how it may compare to conventional medicine for those people out there, because autoimmune conditions, autoimmune diseases are rampant. We're essentially in an epidemic of autoimmune diseases, and there's different types. Digestive problems are a huge problem. And I know another area that you work in is in hormones, particularly with women and hormonal imbalances, et cetera. So let's hear about your story, because, it's a strong testament to what you do professionally and what happened to you and how you overcame those challenges.
Right. So right after I graduated from naturopathic medical school in 1998, my husband and I took a trip to India. And there's no place like getting sick than India, because you can pick up on all kinds of things there. And I got an intestinal infection, and we were traveling with my mother and father-in-law, and my mother-in-law also got sick. So we both had the same thing. It was picked up in something that we ate. And though the intestinal infection seemed to resolve without a lot of negative consequences, shortly thereafter, and this was after we got back home, I would say probably about a week or two after the intestinal infection resolved, I woke up with extreme stiffness in my right leg, from my hip extending down to my knee. And it looked like my knee was swollen. And I knew I hadn't done anything. I would have known if I injured myself enough to have a swollen knee. And as the day progressed, it just got progressively more stiff, and my knee got more and more swollen. I also noticed that my eyes were red. And I didn't know why they were red. They weren't really, bothering me. There was no discharge or anything. And then it finally struck me. I thought, okay, I just had an intestinal infection, and I had learned about this in school. Certain autoimmune diseases can come after you have an infection, because that infection, depending on what organism it is, can kind of trigger a genetic predisposition to developing an autoimmune reaction. So although I was lacking one of the key symptoms, I told my husband, I said, I think I have Reiter syndrome. It's not called Reiter syndrome anymore. It's called reactive arthritis. And it's usually conjunctivitis, arthritis, and urethritis. I didn't have the urethritis, which is inflammation of the urethra, but I had the other two symptoms. And so it was getting progressively worse. My other knee started swelling. And so I went to an orthopedist, and he looked at me and sent me upstairs to rheumatology. And the rheumatologist took one look at me, and he knew I had reactive arthritis. And so we did some blood work. I found out that I had a genetic marker for HLA. I was HLA B27 positive, which is a certain genetic marker that predisposes you to developing reactive arthritis in the presence of a certain infection. And it can also advance to something called ankylosing spondylitis. So in that time, when I was trying to heal, I had to have the fluid drained off my knees a couple of times, because they were so large and swollen and stiff that I could barely bend my knees. So there was some pain involved, some discomfort, and a lot of worry, because here I was just out of naturopathic medical school trying to start my career, and now I've been taken down by this autoimmune illness.
So by the way, you did not manifest with any of the ankylosing spondylitis.
No, I did not.
Which is an inflammation, of the back, essentially the disc,
yes,
and
right.
Particularly in the lumbar spine. You can get it elsewhere, but
right.
or further up. So it was really just isolated to reactive arthritis. It was to my knees and to my hips. Your hips.
Mostly my right hip was pretty stiff. So I called my homeopathy teacher at the time, Dr. Paul Mittman, who is now president of Sonoran University. And, he prescribed a remedy for me, a homeopathic remedy, a constitutional remedy. And
which was what?
Which was Rustox. And he gave it to me in a fairly high dosage. I think it was a 50 M potency. And probably within a few days, I would say 70 to 80% better.
And real quickly, what would the homeopathic remedy have done, or what, how does that work? I mean, that's a whole other discussion on homeopathy, but maybe just the quick and dirty of what did that remedy do, or,
So Rustox is basically, it's a homeopathic version of poison oak. And if somebody were to ingest poison oak, they would present with a certain set of symptoms. So in homeopathic medicine, you take that substance and dilute it down to the point where there's really no original molecule of that substance left, but you have sort of the energetic imprint of that botanical. And so you can use it to treat a set of symptoms that are similar to what the botanical itself might cause. So
it kind of like it short circuits the frequency, perhaps, or
right.
maybe the imprinting of
right.
that.
It almost like cancels it out or something.
Right. Got it.
So that helped tremendously. But I also did a lot of gut work because here I had this intestinal infection. I knew my gut and my microbiome were probably not in the best shape. It was at that point that I learned that I had a gluten sensitivity, and I went off of gluten. Avoided dairy for a while. I really just went on a full elimination diet, thinking, okay, I've probably got some gut permeability because of the infection, and any foods that I might be sensitive to or that are pro-inflammatory are probably going to aggravate my symptoms further. So I worked a lot on my gut, and I got rid of foods that were like inherently inflammatory. And over time, I made a full recovery, and it didn't take that long. It was probably a 3-month process until I was really back to normal. But I never took any medications. I really just relied on what I had learned in naturopathic medical school with the help of some of my instructors. And it eventually resolved, and it never advanced to ankylosing spondylitis.
Do you remember what the pathogens were?
I never did a stool test. It resolved. But
so I think Shigella can trigger
yes.
that with an HLA-B27.
Yeah.
So you get that molecular mimicry type of situation.
It may have been something like Prevotella. There's others that are strong inducers of autoimmune activity.
Campylobacter, I believe, too.
Yeah. So, anyway, it was, so here's an example too. Old time naturopaths, they did not have a lot of diagnostic testing. And, in current naturopathic medicine, we have so much access to different types of testing, which can really help us direct our therapies. And it's great. But for a lot of people, you may have to just work with them symptomatically because they may not be able to afford to do, thousands of dollars worth of diagnostic tests. And so you have to kind of move forward on, a presumptive diagnosis of what's the most likely thing, and are there botanicals that would cover a broad spectrum of things? What can we do to just move the needle for this patient?
By the way, what was recommended from the rheumatologist?
What was recommended? I mean, obviously steroids are always a cornerstone of, addressing inflammation, but I didn't want to do that because I didn't want to suppress my immune system. I knew it was imbalanced for whatever reason because of this trigger. But I did not want to take steroids. And, this was quite some time ago, so it's hard for me to remember what else he had recommended. I think he was pretty good in knowing where I was coming from. As, a recent graduate from naturopathic medical school, he even let me come in and do some observations with him. So it eventually resolved. So he was happy and I was happy.
So I want to stay on this point of the gut, because if we think about the digestive system, it's essentially the largest immune organ of the body, the surface lining of the gut, the first line of immune defense. That gets breached. Obviously, we can have problems with regards to autoimmune type of reactivity. So in your practice, as a naturopath, and, this is even in the world of functional integrated medicine now, but functional integrated medicine, honestly, learned all these things from your profession, at least in my assessment. Now, I might argue that some of the roots of osteopathy, maybe there was some cross-pollination going on, but really I think, the professionals, back in the day, and there were some obviously forward-thinking MDs many years ago as well. But we talk a lot about the gut, the microbiome. How important is it for you to assess somebody's digestive system, if you can, maybe regardless of what they're coming to see you for, because they might have hormonal problems, like they're in menopause, or they might have headaches, or they might have joint pain, like you described. So I'm just curious, from what you do as a practitioner, how much emphasis do you actually put on the gut?
I put a lot. I think the naturopathic profession itself just really focuses a lot on the gut because, it's our interface with like things that are not part of our body. When you're eating or you're breathing, all of those mucosal surfaces that line your gut, your mouth, your sinuses, that's how we interact with the outside world. But in terms of how I assess somebody, I feel that it's really important because a lot of inflammatory disorders, chronic ongoing disease, joint pain, even some hormonal imbalances, because the microbiome can affect how well we detoxify and clear hormones, and all of everything that, we absorb from our gut is going to have a first pass through the liver. So the liver can get affected by different organisms. And if we have a leaky gut, a lot more is getting through that the liver has to process, and a lot more stuff is getting through into systemic circulation that may promote inflammation and cause a lot of other problems. And so looking at the gut for me is key to really removing obstacles and addressing the root cause of the problem. I always look at the gut.
So it's obvious to me that the gut plays a big role in autoimmunity, right? Because leaky gut, porous gut, you just have antigen penetration, and then you've got genetic susceptibilities and molecular mimicry, and then you get these cross-reactive kinds of problems. But it's probably not intuitive to a lot of people in the role that it plays in hormonal balance and imbalance. So from a conventional standpoint, I just have menstrual irregularities, and so we have to just try to manipulate the hormones. So explain a little bit more about how you view the digestive systems. You mentioned first pass through the liver, these types of things. What happens perhaps if somebody has a sluggish bowel? They can't get rid of things their body's trying to detox. How does that sort of mess up their system from a hormonal standpoint? Can you just expand on that a little bit?
Sure. So, a lot of patients that I see, the majority of my patients are women, and usually there's going to be a hormonal component that comes up somewhere. I always ask about digestive health. And interestingly, lots of people say, well, it's fine. It's fine. But then you get into more detail. Well, do you have a bowel movement every day? What does it look like? We as naturopaths really want you to describe your stool. So for me, looking at how well do you eliminate? Do you eliminate completely? Do you have a good bowel movement every day? Because if somebody is constipated, let's say they have a bowel movement twice a week. First of all, you generally don't feel that good when your gut is locked up. You just can't feel good. It affects how you feel mentally. It's just uncomfortable. But in terms of hormones, your body processes hormones. They're going to pass through the liver. The liver is going to conjugate those hormones and dump them into your bowel to clear them from your system. And if you're not moving your bowels effectively, or if you have bacterial imbalances or a certain type of dysbiosis that increases certain enzymes that cleave off what the liver has conjugated those hormones to, they'll get reabsorbed. They're not getting cleared out of your body. So it's not that you are making too many hormones. It could be that you're just not clearing them optimally from your system. And that can sort of gunk up the works when it comes to hormonal balance, or women can start to present with symptoms of estrogen excess throughout their menstrual cycle. A lot of breast tenderness and swelling and cramping or bloating. And some of this could be related to their ability to actually clear hormones from their system. So I always start with, when you think about detoxification, we've always got to start with, well, how do things get out of your body? So we want to do liver detoxification, kidney detoxification, all of these things. But we have to think about how things are going to exit the body. So we really have to support the bowel and clearance and making sure that all of those things that get processed through the liver are eventually going to make their way out of the body via the bowel.
Well, that brings us to phase 1, phase 2, and those are the two main phases of liver detoxification. So phase 1, moving something from a fat-soluble form into a water-soluble form, and then phase 2, obviously that final transformation. But explain that a little bit, because you also talk a lot in your teachings about a phase 3.
So phase 3, to me, phase 3, and I think it's more common now that they talk about phase 3 liver detoxification, is bile production and release. That is how the liver actually dumps things into the bowel. And in order for that to happen, there is a cascade of digestive processes that need to occur in order to trigger the release of bile. And one of those is you have to have enough hydrochloric acid in your stomach. And so the whole digestive process can be somewhat subdued if somebody has low acid production, because it's that very low pH entering the upper small intestine that is going to trigger the release of bile and the pancreatic enzymes. And what the bile is more alkaline, and so the body is going to secrete more bile the more acidic the contents of the stomach are, to neutralize that pH a bit, because the stomach can handle a low pH, but the small intestines are not, designed for that. So secreting enough bile serves many purposes. One is to neutralize that stomach acid. The other is to stimulate the migrating motor complex in the small intestine, which is to stimulate motility, and to also detoxify the liver. That's how the liver gets rid of all of those things it's conjugated and is trying to detoxify so that it can dump it into the bowel. So a lot of people will have just sluggish production of bile, like their bile is just sluggish. It's not liquid enough, so it doesn't move out very well. And you can determine that by doing perhaps a stool test that's measuring steatocrit. If somebody has a high level of steatocrit in their stool, they're not breaking down their fats very well. So it could be a liver thing, a biliary thing. It could be that they're eating a lot of fats. That's another thing. So you have to inquire with your patients to understand fully why they might have an elevated steatocrit. But, that is how the liver is going to detoxify. It has to have a way to get things out of the body. And so phase 3 detoxification is bile production, bile release.
One thing I think is important to emphasize too, for a lot of people, is I think people don't understand that the body is amazing in its ability to recycle compounds. Mm-hmm. So as things are moving through the liver, many of those things sometimes get repurposed elsewhere. So the body and the biochemistry of the body has an amazing efficiency to repurpose things. But then there are certain compounds that just need to be eliminated. Mm-hmm. And so we can transform neurotransmitters, for example, and get rid of excess and then repurpose things. The same thing with hormones. Mm-hmm. Right. So you don't want a continual buildup of hormones, because then that has its own problems. And what you're describing through that phase 1, phase 2, and then phase 3 transformation is a way to get rid of, maybe excess or just the metabolites of hormones, mm-hmm. so that the system is in balance. Would you agree? Yeah,
I would agree. When you think of a menstruating woman, she's producing a level of varying hormones throughout her cycle. And they have to be produced, and they have their activity. They go bind to their receptors. They're signaling molecules, so they stimulate production of certain proteins and different things that happen. But then they have to be cleared, because the next day there's going to be more production of hormones, because that is what the ovarian cycle does. And so we want to make sure that there's not a buildup of hormones that are half processed or half cleared that are contributing to, symptoms of hormonal imbalance. So it may not be production; it just could be elimination of hormones.
So you mentioned first pass through the liver, mm-hmm. and what is that? What does that mean?
That means it is passing through the liver first. So it's entering circulation. It's passing through the liver for detoxification. So phase 1 needs a lot of nutrients. You're basically, as you said, making things more water soluble, and water soluble compounds are easier to clear. And then it enters phase 2, where you're basically binding it to a molecule to allow the body to recognize that it's going to be eliminated. And it it makes it so that you can't reabsorb and reutilize that hormone again. So you're like binding it up so that it can't be activated again.
So once the hormone metabolite, the broken down compound, is moved into the gut, there's always that potential for reabsorption. Mm-hmm. So which we know that in somebody who's constipated or who has sort of downstream dysfunction where they're not moving things effectively, you mentioned the migrating motor complex, that's sort of moving debris through the small intestine into the large intestine. How much does that reabsorption of hormones just interfere with the overall pool of hormones throughout the body, particularly like sex hormones, for example?
Well, in looking at, we're looking at the cause of why, a lot of people have dysbiosis or just bacterial imbalances for various reasons. But depending on the makeup of the microbiome, there's going to be some bacteria that increase something called beta-glucuronidase, which is an enzyme that cleaves off that conjugated molecule on estrogen. And that is another thing that can be measured in stool. It's a common measurement. So if it's elevated and you have a woman who's got hormonal imbalances, that is a key that you need to start working on her gut so that she is not cleaving that bond between that estrogen and that conjugate that it was bound to. And, so getting back to just increasing the pool of estrogen is just going to re-enter circulation. It just kind of goes back into the liver, and it sort of puts an extra effort on the liver by having too much circulating estrogen around that, you're producing new estrogen, but you're reabsorbing the old stuff too.
Interesting. Do you know of the types of bacteria that produce that enzyme? How easily they're compromised by, let's say, antibiotics or chemicals in our foods or...
Well, I think that it's still all in flux. I can't name any particular bacteria, but I use a lot of the GI map testing, and it'll basically give you a good measurement of commensal and keystone bacteria that you can look at. And you can often see just by looking at commensals and opportunistic bacteria and looking at the levels of those if there is a dysbiosis going on. And so I usually just go in. I'm not as focused on a particular bacteria as just the overall picture, because there's so many bacteria that we can look at testing, but then there's a lot that we don't look at. So we get a good general representation of what a person's gut is looking like when you're doing some GI testing, and you just move forward from there and trying to repopulate with some good bacteria, trying to get rid of some opportunistic bacteria that can be pro-inflammatory or might be prone to stimulating the production of beta-glucuronidase.
So what are some things that people can do that just enhance bile flow? And just maybe moving things through the liver?
I always encourage people to incorporate maybe bitter foods or bitter herbs into their diet. That's one of the simplest things you can do. Bitter greens, bitter herbs, you can just get liquid bitters and have them before a meal because that stimulates bile flow. One of the reasons I think that a lot of people really like their coffee in the morning because it stimulates a bowel movement for a couple of reasons. One is that it is bitter in nature. Coffee has a bitter quality to it. And it also is kind of stimulates bile flow just because it's like this warm beverage in the morning. So the bitter qualities of coffee tend to stimulate that very well for a lot of people. So they tend to clear their bowels pretty well in the morning. That's why people get very attached to their coffee. Lemon juice, different supplements, that have bitter qualities or different botanicals, like artichoke, dandelion, beetroot. I often use a lot of phosphatidylcholine, which helps to make bile a little more liquid so that it's more flowing. So I incorporate those things, bitter herbs, foods, warm water. I encourage people to have sort of a morning routine to get that bile moving. Fats also stimulate bile flow, obviously, because they're used to digest fats. So, the whole thing about doing like the bulletproof coffee where you're having your coffee and you add either some ghee or some coconut oil to the coffee, So you have the bitterness of the coffee, and then you have the fat, which can stimulate bile flow. So it's a good combination in that way.
That's one of my favorites, is coffee with a little bit of coconut oil and some ghee. So it's interesting in your description of the liver function to the gut to reabsorption through the first pass concept to bile flow and hormones. I can also see how this could help in general somebody with an autoimmune condition, because we talked about how the gut is a central point to assess and evaluate and work on for any autoimmune condition. So we're decreasing that antigen penetration, the absorption of things that can trigger, but it's also about elimination.
Right.
Right. And so, and you mentioned, about how bile stimulates the migrating motor complex. And the more for people to understand is that migrating motor complex is really critical, particularly in the small intestine, to just keep sweeping the small intestine of things that are entering it.
Right.
Whether it's coming in from the liver or coming, from the mouth to the stomach, and we're trying to move things out. So we decrease the potential of things to be absorbed that maybe shouldn't be.
Right. And also decreasing, when we talk about SIBO, small intestine bacterial overgrowth, the migrating motor complex is a key component of keeping things moving through the small intestine. Because if they sit there too long and they aren't digested well, let's say, again, going back to the, this cascade of events that needs to occur for good digestion. If you've got low stomach acid, that doesn't trigger the release of bile or release of pancreatic enzymes. Whatever you're eating, especially carbohydrates, may not get digested well. So instead of digesting, they're fermenting and sort of sitting there. So if that migrating motor complex isn't sweeping things through, they just kind of sit there and ferment and produce a lot of gas. And, that's where the SIBO testing came from, looking at, methane production and hydrogen production after taking a load of sugar to see if there's a bunch of bacteria in there fermenting. And that can just disrupt motility, not only in the small intestine, but in the large intestine as well. And I also feel that, if people are inherently constipated, they're just not moving their bowels very well, you can get sort of this back pressure in the large colon or in the large intestine that pushes up against the ileocecal valve, and you can get a migration of bacteria from the large intestine into the small intestine that also contributes to the development of SIBO.
Yeah, because I've heard you talk a lot about, from the standpoint of SIBO intervention, is to understand that the digestive system is a fully functioning system. It's not just the stomach. It's not just the small intestine. It's not just throwing a bunch of herbs into the small intestine to kill back bacteria. It's trying to understand how it's all integrated.
Right.
And you teach on that concept, and I know you practice on that concept. So correct me if I'm wrong. Maybe safe to assume that for the most part, people who are coming to consult with you, whatever their condition may be, one of the things you're going to be looking to do, obviously, is assess the gut. What about food and food sensitivities and these types of things? How does that wrap into this general aspect of naturopathy? Obviously, it played a big role in your recovery from your reactive arthritis, finding out you were gluten intolerant. We could have a whole discussion on diet, but, do you do, typical food sensitivity assessments? Do you just do elimination types of diets?
I think it depends. If I feel like somebody's got a lot going on in their gut, I'm probably not going to do food sensitivity testing right away. Because they may come, I don't feel like the test will be fully accurate, because if they've got a lot of stuff going on in their gut and they potentially have a leaky gut, they may turn up showing like they have a lot more reactivity to foods than they really do. And so I work more on eliminating the problem that is contributing to their leaky gut and work on healing the gut and getting elimination good and digestion in place, all of the functional aspects of a healthy digestive tract, work on that first. And then if they've still got some lingering issues, then going in and doing some food sensitivity testing, I think, is warranted, because I'm always concerned about, having somebody pay for a test and not getting an accurate result. So if I'm going to do food sensitivity testing, I want to make sure that I work on their gut first so that we can get the best possible usable test result.
Yeah, I think that's excellent. You're right. An inflamed gut, a dysbiotic gut, people oftentimes will have a lot of things that kind of light up on a food sensitivity test. So what are some of your personal areas of interest?
Well, obviously digestive health. Obviously, I work on digestive health a lot. That's a cornerstone of what I do. And I work with a lot of women on adrenal issues, thyroid issues, natural hormone replacement, in both younger women, midlife, and women who are entering menopause. I think it's important to try to help women balance their hormones throughout their life and have a good understanding of what is going on hormonally at the phase of life that they're in. So I like to focus a lot on that with women. And, I like to work with women who are sort of in that midlife area where things are changing for them. There may be perimenopausal, but that phase of life, perimenopause, could last 5 to 10 years for some women. They're noticing changes in their body and their hormones and their cycles. And it's just sort of like this slow moving train. You know it's eventually going to come, but you don't know when. And you're starting to feel some changes. There's some rumblings going on. And you want to try and help these women have a healthy and easy passage into the next phase of their life.
Let me ask you this. So if you were to speak for your own experience in some of the transitions you've gone through as a woman through the hormonal cycles and the changes you've experienced, and what you've seen in some of your patients who come to consult with you when they are going through this from a conventional medical route, as opposed to your experience having gone through some of those transitional periods, but applied the things that you're talking about here from a naturopathic standpoint. What could people expect?
So let's say a woman comes into me, she's midlife, she's having some hormonal changes. She really doesn't know what to do about it. She may have some other issues going on that are related to fluctuating hormones, like getting headaches or having insomnia or, feeling more emotional. One of the things I'm going to do, especially if she's cycling normally, is I'm going to look at her hormones. What are you producing right now? Women can still have normal cycles, but have some hormonal imbalances going on within those cycles as they enter perimenopause. One of the first things is going to be usually an anovulatory cycle where they don't ovulate. They're still producing enough estrogen to have a period, but they may not produce any progesterone in that cycle. And so they may be more symptomatic in terms of like symptoms of estrogen excess. So measuring hormones is one of the first things that I do, is let's get a baseline and see where you are, because it's going to be progressing. So we want to know where you are now, and we want to address what the problem is now. I also feel that aside from just looking at sex hormones, looking at adrenal function and thyroid, and getting a good sense of the whole endocrine system as we can measure it is going to give me some good feedback so that I can make sure that I am treating the right thing. Because thyroid imbalances, adrenal imbalances, changes in ovarian hormone output, there's a lot of crossover of symptoms between those three glands. So you want to make sure that you're treating the right thing. So testing up front is one of the things I do. And for a lot of women, it could just be a blood test. If they're not on any hormones, we can very easily just send them out to a regular lab, and we can look at the thyroid. We can look at sex hormones. I do like looking at the adrenals through a salivary test because we can get a 4 to 6 point measurement of salivary cortisol levels throughout a single day. That's more telling than just getting a single cortisol level in blood, because that doesn't tell us what your adrenals are doing throughout the day. And there's a diurnal cycle in the output of adrenal hormones, and so we can capture that much more easily with saliva.
And what is that relationship between adrenal cortisol, adrenal DHEA and sex hormones? DHEA obviously can feed into estrogen, testosterone, but from a cortisol standpoint, Why that test? Because that's an area that I see is often overlooked in conventional medicine.
Right.
So they're just going to do straight up testosterone, estrogen, but they don't really look at anything else in a much more cohesive way. So what's been your experience?
Well, I think as far as adrenal health goes, I think conventional medicine doesn't really acknowledge this sense of adrenal fatigue. And maybe it's not a great name, but it is the gland that helps us to respond to stress. It's well known how this gland functions. And when we're in stressful situations, we are going to respond in that fight or flight response. And it's a very primitive response that is deeply ingrained in our physiology, but our stressors today are much different. They're kind of this slow burn of stressors. And so oftentimes, especially women in midlife, they're usually in the thick of it, right? They've got careers, they've got kids, they may have aging parents. There's a lot going on. And so adrenal fatigue or dysregulated output of cortisol can impact their sex hormones as well, because you're going to be somewhat reliant on your adrenals to sort of back up sex hormone production peripherally when the ovaries start to shut down and as you enter perimenopause and menopause. So looking at the adrenals and supporting the adrenals and supporting that stress response is really important, because usually women and men too are going to be experiencing a lot of stress midlife because there's a lot going on.
So maybe it sounds cliche, but I'm going to ask it anyway, because a lot of people talk about lifestyle, right? The impact that lifestyle, eat better, sleep better. We all sound like a broken record saying that.
I know.
But when you get down to the crux of chronic health problems, autoimmune, gut, hormone, how big of a role does it really play in your experience?
I think it's huge, because that's the doctor as teacher part that is so important in naturopathic medicine, because we come back to, what are you eating? How are you sleeping? Are you drinking enough water? Are you getting sunlight? Are you getting outdoors? Are you exercising regularly? What are you doing for stress management? Are you breathing? Do you take good deep breaths, or are you breathing from your throat? All of these really basic fundamental things that have an impact on our physiology and our overall health are so important. In terms of food, to me, food is one of the most important things. That's how I came to naturopathic medicine. It was my interest in food and nutrition. But there's so many diets out there, like these different diets that sort of surface and gain popularity, and people are so confused about food. And so for me, my advice often is to patients is, regardless of how you want to structure your diet, if you're doing a paleo diet or a carnivore diet or a Mediterranean diet, all of that is going to be composed of food. So make the best choices of food. The quality of the food is the most important thing, however you decide to structure your diet. And I think that's key. And I love the book by Michael Pollan. It was called Food Rules. And so you go through this book, and everybody's got ideas about what's the best food, what's the best diet, what's the best this. And he came to a single sentence conclusion, which I love, which was eat real food, not too much, mostly plants. And so I thought, this is genius, it just kind of breaks it down to, how humans have survived for centuries. It's just eating a good variety of foods that's high quality, not processed, good fats, high quality protein, select carbohydrates, and sort of balance your meals. And that's where a lot of the education comes in. Quality sleep, I think, is super important too, adhering to and understanding natural circadian rhythms and, acknowledging when you get tired, turning the lights down in your house as the sun goes down so that you can produce melatonin and induce all of those healing, restorative effects that happen during sleep. These are also really important. Learning how to manage stress, how to compartmentalize things, how to reframe things that stress you out, how to, check in with your body and see if you're actually breathing deeply. because when people don't breathe deeply and oxygenate well, they're going to activate that sympathetic nervous system response and stimulate the stress response overall. You know?
Yeah, I think this is so important, and I think it's important to understand it. These things done consistently over time.
Yeah, it has to be inherent in your daily life. It shouldn't be something that is work for you. It can be initially, but once you employ these foundational principles, everything else can get better. And, so when it comes to naturopathic medicine, a lot of people want to seek naturopathic care to sort of replace their medications with some sort of naturopathic therapy. But it's so much more than that, because we have to consider all of these other factors that contribute to health, and they have to be in place in order for somebody to get to good health and be able to maintain their good health.
I've often said that, functional integrated medicine isn't the, what's the supplement alternative to whatever, right? The same thing with naturopathic medicine,
Yes,
there's
so
obviously,
much bigger.
it's these terms or these principles, as I mentioned before, to me, the roots of functional integrated medicine go back to the roots of naturopathy. But we live in a world, in a system that people are looking for alternatives, rightfully so. But, it's more than just, this supplement for that medication.
Right.
That's a start. That's okay in certain circumstances. I mean, I've had many individuals clear certain infections they have, whether it's bacterial or fungal problems with botanicals or a grouping of probiotics, and that's great. But in the grand scheme of things, from an overall chronic illness standpoint, it's much more than that. So, real quickly, just give the listener just kind of an overview of the types of people you see. I mean, you work a lot with women. Anybody else, other areas that you tend to focus on?
Well, when you go back to the basic principles of naturopathic medicine and really trying to support people in those foundational principles, you can be a generalist and you can see a lot of different people with different conditions, because if you start to build health, whatever disease or condition that they have is going to improve. So just by employing basic principles of naturopathic medicine and utilizing some really common things, it seems, as you said, it seems cliche, but we've almost disregarded it because it does sound cliche, and people want to get to the heart of their problem. Like, I want to treat my, my skin condition, my eczema. And I'm like, okay, well, this is much bigger than just a skin condition. In order to really address something well and to prevent future problems, you really do have to have the foundations in place. So in terms of what kind of people I see a variety of people. The majority of my patients are going to be women. They are women, but, and there's going to be a hormonal component. But I think that naturopathic medicine has something to offer for a lot of different conditions, because once we address some of those foundations and, perhaps work on detoxification and clearing obstacles, a lot of things tend to improve.
I 100% agree in that. One of the things that I've worked on in my practice and over the years is the diagnosis that somebody comes with. It is important to some degree, certain genetic disorders and whatever, there's certain limitations, but ultimately the diagnosis doesn't always tell you about what's going on. And if you apply so much of what you're talking about and your profession has been promoting for decades, that the rest of us have now been following, so many people with a wide variety of health problems, regardless of their diagnosis, can get improvement. So last question is, what naturopathic words of wisdom would you like to share with people who are listening to this podcast?
Well, it goes back to kind of the foundations of good health. And when I was about 18, I graduated high school. I moved to Hawaii for 3 years. And just by being in this beautiful environment, for me, it's a very health promoting environment. I came from Los Angeles. I just wanted to get out of where I was. And I had the experience of watching myself evolve through some of these basic principles of eating good food, being outdoors, getting natural sunlight. And in my situation, swimming in a beautiful salty ocean and getting exercise and all of these wonderful things, And I changed over that period of time. And so really basic stuff that you can implement in your daily life, eating the high quality food, making sure you get a good night's sleep, and, employing those principles of sleep hygiene, learning how to manage stress, getting outdoors anywhere you can get to where there's grass and nature, and you can breathe in fresh air and move your body, I think is really, really important. And that, to me, are some of the foundational things that I think we all need to implement. I mean, I was listening to, I think it was Mark Hyman was just talking about just different programs that people put together and how more functional medicine has gotten very, very narrow in their treatment. And he felt like we as integrative practitioners need to be more generalists, that we need to look at a lot of these foundational things to see how they can be applied across a broad spectrum of illnesses. Because again, this is truly foundational. Unless we have those things in place, none of the other therapies that we try are going to be as effective.
Yeah, it's very true. We can definitely become over-specialized in this
and
area
we
of
lose
medicine.
can't see the forest for the trees kind of thing.
Right. And I mean, it's okay to understand, certain principles of underlying problems and whatever, and address certain things very specifically. But the backdrop should always be what you're describing, is these natural healing principles that are being infused, and followed on a daily basis consistently over time. Because there is, I've always felt, and this is a core aspect of osteopathy, and I know it's a core principle of naturopathy, is there is an inherent wisdom in the body that is always trying to move towards a state of health and balance. And much of what you've been talking about is ways of trying to remove those obstacles. Living on planet Earth, being a human being, being alive, it inherently has its challenges. And so there's no perfect way of, we can't control all the variables, but we can, certainly do things to try to increase the odds. So, Tracy, thanks so much.
All right. Thanks for having me.
Being on the show is great information. Thank you.
Thank you.
You've been listening to the Functional Medicine Doc Talk podcast with Dr. Kurt Woeller. For more information about this podcast, go to functionalmedicinedoctalk.com.